The HTM Enterprise Knee Recovery Project Overview. Before we start, we'd like to recognize our sponsors for the project, which include the MTU departments of Cognitive Learning Sciences, Kinesiology and Integrative Physiology, and Enterprise. Let's first start with some problem background knowledge. Each year, nearly 100,000 ACL surgeries are performed, given that ACL reconstruction is the most common athletic injury. Currently, recovery is largely determined by experienced physical therapists through qualitative visual assessments. However, there is a lack of quantitative mechanisms to measure the recovery of a knee and the surrounding muscles following surgery. So given this, our problem statement is to create a device to help quantitatively assess strength, stiffness, and endurance following a knee injury or surgery. Currently, there is a device on the market called Biodex that addresses this issue. However, it costs $3,236, which can be very unaffordable to our rural clinics, such as the ones found here in Houghton, Michigan. The device is also quite large, and we found through meeting with physical therapists that they'd much rather prefer a physically smaller device. Previously, we had created a flywheel device to address this issue. However, we found it to have many cons, which included how bulky and expensive it was, as well as the flywheel providing an inconsistent force that could pose a danger to the patients in knee recovery. Our new proposed solution, however, will utilize a goniometer in tandem with a specially housed load cell to measure strength, stiffness, and endurance. Using this new device, the patient will exert force against the load cell to the best of their ability while wearing the goniometer. Both sensors will send data to a program which will interpret the data and produce readable results that a physical therapist can view. And all measurements will be taken on both knees in order to compare the knee in recovery to the opposing healthy one. The first measurement, strength, will be measured using the load cell and performing leg extensions with as much force as the patient is comfortable with. Stiffness will be measured using the goniometer, which will calculate the angular velocity of weightless extension of the knee. And finally, endurance will be measured through assessment of the quality of leg extensions over time in comparison to the healthy knee. Our next steps with this device are to purchase a load cell, data collection equipment, and building materials to test different housing schemes that allow comfortable use by the patient while also delivering accurate results. We will also be continuing research on physical therapy protocols in order to fine-tune our design and suit physical therapist needs. Here are our citations, and thank you for your attention and interest in our project.